Good afternoon, everybody. My name is Franklin Prada. I'm the president of the ADTO. I'm with Judy Rigby, the registrar and CEO of the college. Um, we're pleased to be co-hosting this town hall today and appreciate that so many of you have joined us for this town hall on the short notice. Since March 17, 2020, when an emergency was declared in Ontario due to the outbreak of COVID-19, the CDTO has provided updates on the impact of the pandemic to its RDTs through email and its website. The ADTO has hosted several town hall meetings to keep its members informed and field all your questions and concerns. Together, we have kept an open line of communication with the CDTO because the health and safety of the public is important and includes RDTs as well. So we got to protect ourselves. On Tuesday of this week, we received wonderful news that the RDTs of last weekend can start a gradual return to practice, and you played a big role in making it happen by ceasing to practice when we asked. According to the chief medical officer, there still may exist an immediate risk to the health of persons anywhere in Ontario from COVID-19. So today we want to provide you with the information which will help you return to practice in a safe way. Thank you, Judy. I'll pass it on to you.
Okay, thank you. And I would just like to definitely reiterate what Franklin said. This is a terrific opportunity for the association and the college to collaborate on a communication to the RDTs, especially at a critical time. The slide that you have in front of you is essentially what our CDSO has posted for the duration of the COVID-19 crisis with dentists' ability to provide in-person care, and stating that it will take place in one of three stages. And why I think it's important for us to show you this slide is because we do understand that your client is the dentist. The three stages that they've described are not static. So at stage one, which is what was at the height of community transmission, and could again happen once again, depending on what the outcomes are of the COVID-19 pandemic. They had in-person dental care was restricted to emergency and urgent care only. Stage two was that the community transmission, as it declines, dentists would be permitted to provide an expanded list of in-person services, and essential care only would be permitted in person with enhanced precautions. And then stage three is when community transmission has been significantly mitigated, dentists will enter the new normal in which in-person services could be provided with reduced precautions. So as I said, the RCDSO was very clear to say that this is really quite, it's not static, and over time, dentists and RDTs may move forwards or backwards between stages as community transmission ebbs and flows. So I'm really thrilled, as Franklin said, to have you join us today. We just want to go over the agenda very quickly. First, we will speak about our COVID-19 fee relief. Secondly, COVID-19, what does the new normal look like? And then good laboratory technicians are hard to find. And finally, because we want to spend a great deal of time educating you and fielding your questions, it's about the return to practice guidance for RDTs. So with respect to the COVID-19 fee relief, I'm going to ask Shabana to speak to what the association has managed to do for its members.
Good afternoon, everyone. Thank you for joining us today. COVID-19 has brought a big twist in our lives, in our businesses and economies. The key is to stay calm, positive, and control the controllable and embrace the change. We hope and pray that you and your families are safe, doing well in this pandemic. Our hearts go out to the people who may have been affected and their families. We have thought deeply as the board of the ADTO to understand how we can potentially help our members during this crisis, and cut our membership fees by 30%. The insurance part remains the same as it is, unless the insurance company is ready to do something. We hope this change will make a little difference in all of our lives. So to understand better, our actual membership is $551.99 plus HST, and we are giving a discount of 30%. So that's a discount of $175.59. So this year, our membership would be $385.40 plus HST, and the insurance part is 67 plus 7%. So I hope this change will make a little bit difference in all of our lives and our professions. And my strong message to all of us is, together we will and we can make a difference. Thank you very much for joining us today.
Thank you, Shabana. And I'll turn it over to Franklin, who would like to just remind you about the personal liability insurance, or professional liability insurance, my error.
Thank you, Judy there. So PLI, previously in our Zoom meetings, we had mentioned that we were going to get in touch with our PLI providers to ensure that going forward, our members are, working within, insured and within their scope. As it turns out, with the CDTO and our research, we found that the PLI actually does cover the RDTs, the members, with their scope of practice. That being said, if you have patients coming to your practice for doing a shade taking or stain matching, you do have there. If you go over to the dentist clinic practice to do that shade taking or custom staining, your PLI will cover you in that aspect. Due to the COVID, it is recommended that you, if you can, to suggest or request that your client, the dentist, do the shade taking for now, just so we can prevent the spread of COVID-19. If in fact you have a patient coming to your clinic, it is recommended that you do follow the clinical procedures of proper patient screening prior to coming to the practice. And I believe the CDTO will go over with some recommendations as to the PPE that's required in doing so. So I'll pass it over to Judy there. Thank you, Judy.
Okay. Thanks, Franklin, for that clarification. So with respect to the college's COVID-19 registration fee relief, I just want to say that, council deliberated, the executive committees met a couple of times and are really quite very happy to be able to announce the COVID-19 registration fee relief. The fee reduction was approved on May the 25th, 2020, and the renewal period it pertains to is for 2019-2020, which ran from September 1, 2019 to August 31, 2020. Now it starts, essentially, even though we take the membership dues at the beginning of the year because we have to procure the stamp, we want to make sure that our RDTs have their full professional liability insurance in place, et cetera. We take it, the money at one time by August 31st. However, that amount of money that you pay to the college is really a monthly fee. And the monthly fee, so the monthly fee breaks down and applies to all 12 months of the year. So the COVID-19 fee relief is for the months March 19th, when the CMOH directive number 2 came out, and will run to August 31st, 2020. So if we take the annual fee of $1,711, which includes the RDT stamp, that breaks down to about $117.60 per month. Well, we understand that many RDTs also qualified for CERB benefits, and I do hope that you've all applied for them and are receiving them. So about 90% of that monthly fee is going to be rebated to any eligible RDT who paid for their general certificate of registration and also their RDT stamp fee. In total, it's about 40% of that annual amount, and you will get back $686 for the year. How will you get your money? Well, it'll be credited to your account so that your 2021 renewal invoice will reflect the credit, and then you'll only be asked to pay the net amount. We also will continue to have the same renewal dues timeline, which is midnight, August 31st, 2020. So you might ask, why is it that we're not just going to give you the money back or do a refund? Well, we understand that the denturists are doing that. However, we also understand from their experience that it is administratively, it takes up a lot of resources, and we really do not want to burden the membership with additional costs from that sort of administrative, duplication, providing refunds. So that's why we've chosen to do it this way. Okay. So if you have any questions, by all means, contact the college. So on to the next agenda item, which is COVID-19, the new normal. And in this, we are going to discuss what does the patient, or what will the patient and the client expect now that we're heading back into providing essential services, and the fact that the COVID-19 pandemic continues to exist. It may not be at the pandemic stage, but we know that the chance of reoccurrence is still high. So with the health and safety of patients and clients, we always have to remember that the public and practitioners is our top priority. Jointly, the colleges and oral health colleges and the associations met and came out with a statement about what the guiding principles would be for oral health care. And I am proud to say that that document is published. You'll see all of the logos for the colleges and the associations on it. And essentially, this is the first of the 8 principles. So we really need to think about when we are, we talk about raising awareness, but really we need to be informing in the public interest. And we have to inform the patient. We also have to inform the client of the RDTs, which is the dentist. Some colleges have used the Citizens Advisory Group to find out what is the public going to expect from their healthcare provider. And also keep in mind that I very often hear, well, it's the RDTs are behind the scenes. It's at the end of the day, it's the dentist that's accountable. But I would argue that point with you. I would say that it's the RDT that's accountable, because you have to look at it from the perspective that the patient that's sitting in the dentist chair, you're the one filling that prescription. Whether the dentist places it in their mouth or takes the impression, it really is falling to your shoulders. So we have to anticipate what the patient and the dentist will ask because of this pandemic. So, and the other thing to consider is, if the patient has a complaint or the dentist has a complaint, it's really only the CDTO that can help if the provider was an RDT who's registered in Ontario and made the appliance. It's the RDTs who are fully qualified. It's not the laboratory technician. So in looking at this slide, if I'm a patient, I want to know now, especially, where was the denture or the crown or any other appliance that my dentist put in my mouth or my child's mouth, where is it being made? And I'm sure you've heard Ford say, source locally. You know the quality of the product when it's coming from Ontario. So critically, the patient wants to know. I want to know as a patient, is that thing, that appliance that you're putting in my mouth, is it safe? Is it good quality? And if something goes wrong, who do I talk to? Well, I can only file a complaint. I can file a complaint with the RCDSO because I know who my dentist is, but I really need to know who made the appliance. So that way I can file the complaint with the CDTO. For the dentist also needs to know and should be questioning where the denture, the crown, or the appliance was made, that they are putting in their patient's mouth. And this is going to be even more critical now. Is it safe, of good quality? And if something goes wrong, who do they talk to? So there are discussions between the professions about how we can make this happen. Going along with that, you need to know who is working behind the scenes, or they need to know who works behind the scenes to design, fabricate, and repair what the dentist prescribes. Is it the laboratory technician, or is it the RDT that's registered and regulated in Ontario? And why I want to raise this point, and this is my opportune time to raise it, is that when it comes to supervision, laboratory supervision, it's the RDT's responsibility. The dentist does not want to know that the only person that touched the prescription was the laboratory technician. The only person that looked at the prescription before releasing it was the laboratory technician. That times have changed, and this is going to be an expectation. So why should the informed, who is the patient or the dentist, be able to say that they got the device or the appliance from an RDT? It's because RDTs have demonstrated entry to practice competencies and performance indicators. I hope you all know that there is a new national essential competency document that you will live and breathe, that you'll see through your QA, and that all graduating students, anybody entering the profession, is being held accountable to. So these, we know that you as RDTs have those necessary competencies at the entry to practice stage when you start your career. But they also, RDTs have the knowledge, skills, and judgment to provide the appliances that are ethically sourced, safe, and meet high quality standards. So this slide essentially speaks to where can the dentist see that it's the RDT that has actually fabricated it, that it's not coming from a lab that's considered what we call an illegal lab, that it's not coming from just the hands of the laboratory technician. So I'm going to start with the dentist. The dentist needs to be able to train their office staff to look for the RDT stamp. It's significant. It means something. They also need to look for the proper dental labels. I'm understanding, that material stickers go with the cases, so that's important for the dentist to be able to see that. But their assistants also need to be trained what to look for. And we need to talk about this with the RCDSO, with the ODA. They should expect an MSDS sheet. It would tell them about the materials, it'll give them more information, and somewhere on there should be the RDT's name and registration number.
I can definitely add to this. This is looking to be like the new norm, especially if we expect as a profession for the government to realize that we're there, for the public to realize that, who's making these appliances. I mean, there are a lot of times where they think the dentist makes it, right? There's also that, I guess, that worry that you have manufacturers who are going straight to the dentist and saying, here's a machine that'll make a crown, just press the button and it'll make a crown. Well, we're, as an RDT, we're trained in occlusion, we're trained in, how the mouth works, mastication, everything. So it is important that we raise ourselves to a level that that they are looking for these things. The RDT stamp means something. It means that we went through vigorous training, we passed that exam, we're doing our competencies, we're doing our extra education and our CE credits. And it's been fortunate that the CDTO and ADTO are working, closer together to ensure that, public safety, especially now, is of the most important. And we'll continue to do so in providing, courses to gear you towards that. So thank you, Judy. This is beautifully put together and explains it very well what we should be expecting. I mean, the dentist expects us to work at our highest caliber. We should also expect the same from them, right? So go ahead, Judy.
No, that's terrific. Thank you, Franklin. We need to educate the patient. Look for the MSDS sheet. It should be attached to your invoice. Look for the RDT's name and registration number. Look for a sign in the office somewhere that tells you who to call if you have a complaint. And it doesn't just say, call the RCDSO if you have a complaint about the dentist. It should say where to go if you have a concern about your appliance, that you can go to the CDTO. Okay, so we are talking today about locally sourced, made in Ontario. And this applies not only to the dentist. We want the dentist to be comfortable. We want them, for the patient's sake and their own sake, to source from RDTs that are licensed in Ontario. But I really think that it also speaks to the RDTs as well. Both professions are healthcare providers. They're regulated. We're expected to provide ethical, safe, and quality care because this is important. This should stay front and center at all times. RDTs need to educate their clients about patient harm that can result if materials do not meet Health Canada standards. And it's only the RDTs that can do that, not the laboratory technicians. And the RDTs should always put patient safety first. And that's why we are stressing, if you're going to go offshore, you need to know that the materials that you are using meet Health Canada standards. It's not about whether life becomes easier for the healthcare provider. It's really about putting public protection front and center. Someone said to me in a little note, and it was an RDT actually, no one expected these unprecedented times. And when things go wrong, people tend to make decisions that are based on emotions or financial stress rather than logic. Let's not make that our mandate. Let's remember, or let's please let that not make you make bad decisions as RDTs. So this slide is coined "Don't waste," or termed "Don't waste a good pandemic." And I heard that in a conference, virtual conference about actually virtual proctoring for exams. These are unprecedented times. And as Ford says, they call for a fresh approach. So collaboration between the college, and the association, I think we've worked well together to date, and both, as I said, respect each other's mandate. But I really do find that the association really has a great understanding and handle on public protection. But it's time to get together with the RCDSO again and the ODA, and these talks started prior to the pandemic. So we need to collaborate to get healthcare providers to make sure that they're providing safe and effective treatment to their patients, clients. There are guiding principles, as I said. They are on our website. Please take a look at them. I'm very proud of the work that the association and the college did on this collaboration. But also, there has to be an understanding. I really don't think at this point we need to talk about expansion of scope or controlled acts. We really have to develop this mutual recognition and respect of every healthcare provider's fitness and ability to do what they are trained to do. And we all know what RDTs are trained to do. We're also certain what dentists are not trained to do. Now I think that I will be turning this one over to Franklin to speak to, and it is about good laboratory technicians are hard to find.
All right, thank you. Thank you, Judy. Yeah, so this is something we were discussing with the CDTO, that going forward, IPAC would most likely be a mandatory thing, and how the RDTs would be responsible in training the technicians to follow IPAC. And speaking with other provinces that have technicians, as well as, RDTs and technicians as members, we're looking towards doing that as well. So we were looking at maybe having technicians basically join the ADTO, and they would be open to, they'd have access to education, and we can ensure that, you know, they are up to IPAC standards, as well as a bigger group. We are a bigger voice and can ensure that, you know, things are done properly and that we are recognized. Let me see here. Pathways initiative. So the pathway, the CADR program, what basically means is if you have a technician that has done education afar and has been working with you for a number of years, it could be an opportunity for them to write the licensing exam. The advantage of this is it is hard to find good technicians, and with, let's say, the protocols that an RDT should be on premises at all times, there are places that have one RDT, and it's really hard, as you know, to either take a vacation or if you need to go to talk to a client, the lab is unsupervised, right? So this is a great opportunity as well. So we are, like I said, working collaboratively to see how we can provide all these tools and training for RDTs and technicians. But again, we are guidance from the membership to make this grow, right? Because as the years go by, the number of RDTs is going down. The number of people who are writing the exam has gone down drastically. So this is an opportunity for everyone in our profession to grow. I know Kareem has a presentation regarding what we're doing, and if you can take over there, Kareem.
Yeah, I'm just gonna, can you guys hear me? Yeah, okay, great. So this is just basically on the main thing, the main concern that we're gonna talk about, which is our public awareness campaign. And this is a crucial time to educate the public on what a dental technologist is, what we do, and why it is important to have all dental prostheses created by ARDT, and the importance of looking for a stamp on their invoices. Wow. So as dental technologists, we all have decided to be a part of a group which is considered as healthcare providers. Healthcare propagates in a network manner. Each of us represents all of us. And I'm sure you would all agree with me that the focus is patient-centered care. So providing the public with accessible information will bring an existential relevance to the three identities, which is our individual identity, our group identity, which is ARDT, and the identity of the profession, which is the craft. This initiative allows trained and regulated dental technologists to have the privilege of being responsible for. The safety of the public will also be determined by the knowledge of asking questions such as, where is my dental prostheses being created? What are the materials used to create my dental prostheses? And who is responsible in creating the dental appliances? And these are not only important, but also necessary questions that can be easily answered by dental technologists, because only a dental technologist knows what a dental technologist does, and that is the truth. This is also going to be drastically reducing any outsourcing and also promote locally created dental appliances. And as Judy mentioned before, Doug Ford did say keep things locally, and so did Justin Trudeau, to keep things made locally in Canada. So based on this pandemic, I think this is a great time to further initiate this campaign in educating the public on what we do. Okay, I'll pass it back to Judy.
Okay, thanks. Thanks, Kareem, and that was excellent. In terms of talking about the laboratory technicians, the importance about it is not that the CDTO is saying, get them in and get them to write the exam. I think really the importance is through this project we've been working on with nationally, so with all the regulators across Canada, is that it gives your laboratory technicians this opportunity. You're going to start seeing some stuff launched very shortly to do some practice, use some practice tools to see how competent are they. That means you can see how competent they are. It'll help them to determine if there's some gaps that they should try to close, or to look to you as their employer or their colleague or their supervisor to help them get there, to become better laboratory technicians. So as Kareem said, and Franklin, the number of RDTs is on the decline. And we see that every year at the college. And so if we are talking about public protection, if we're talking about that the patients are going to want heightened quality products, safety, they're going to want to know that they come from an RDT in Ontario, then we have to give the laboratory technicians that opportunity to actually become RDTs, to become the future RDTs, and to be ready when our RDTs today have hit that demographic where they're getting ready to retire or getting ready to pass their labs on to somebody else. So I'm going to hand this over to Leanne Cheng, who is the professional practice and professional conduct for the college, and Rose Farr, who is our policy and research coordinator and manager for the college.
I'm starting with the timeline, and I'll just speak while Judy gets back a slide. So we are going to start introducing the return to practice guidance that was released last week. Before I do that, I'm just going to go over this quick timeline just to talk about where we are today. So as we all know, on March 17, a state of emergency was declared in Ontario, and subsequently the Chief Medical Officer of Health issued Directive Number 2 for healthcare providers. So this is the directive that speaks to requiring all non-essential and elective services to cease. So on April 27th, the Ontario government also released a 3-stage framework for reopening the province. So at this point, that's when everyone's eyes turn to, what would the new normal be when we return to practice during a pandemic? So on May 22nd, which was last Friday, CDTO released its guidance for RDTs on the return to practice. Well, at this time, non-essential and elective services were still not permitted. It was just supposed to be a guidance that supported RDTs in preparing for this day. But as you know, just 2 days ago, the Chief Medical Officer of Health revised their directive, which now allowed the gradual restart of services by healthcare providers. So the Ministry of Health also published a COVID-19 operational requirements health sector restart document with this directive. And so this document speaks to the requirements that must be met in order for healthcare providers to resume their services. So it's aligned with the guidance that the guidance document that the college provided, but we still ask RDTs to read the ministry's guidance document in detail. And each RDT will need to decide whether they can safely return to practice, considering factors such as their workplace configuration, PPE supplies, and the incidences of COVID-19 cases in their area. So more changes are expected to come as we know more about COVID-19. So likewise, the college and the Ministry of Health's guidance would be updated accordingly. Next slide, please. So Judy mentioned the guiding principles that were worked on. These were developed by the Oral Health Regulators of Ontario, so the regulators for denturists, dentists, RDTs, and dental hygienists, along with their respective associations. So you'll see all the logos of the participants at the bottom of the slide. So these principles were agreed upon as being foundational to return to practice guidance for oral healthcare workers. So they speak to the priorities, the unknowns about COVID-19, and the need to really proceed with caution. And these 8 principles are posted on our website in both French and English, and are also included in the introduction of our guidance document. So please take a look at these when you have a moment. Next slide, please. So now we're moving on to just a brief overview of how we developed this guidance. So the college engaged with many stakeholders, including the health profession regulators of Ontario and infection prevention and control working groups, and conducted literature reviews to understand not only what the new normal may be, but also what the new expectations of patients would be. The guidance was drafted with this information and taking into account the inquiries that the college received. We were open to hearing what concerns RDTs had with returning to practice and what areas they were looking for guidance on. So given the tight timeline and the need to respond quickly, our initial consultation was with our executive committee, who provided both the professional and public perspective. Revisions were made and we circulated it to a wider group, which included the ADTO, the Oral Health Regulators of Ontario, the Dental Technology Regulators of Canada, and dentists in Manitoba and Nova Scotia. So we made additional revisions to our guidance document, and it was finally approved by the executive committee and immediately circulated to RDTs. So this all happened last Friday. And so we are continuing to keep up to date and engage with the government for any changes. And our guidance document, as I said earlier, is subject to change with new information. And continue on to the next slide, which Rose will take over and assist us. Yeah, there's a lot of check marks.
Thank you, Leanne. Good afternoon, everybody. everybody. Before I start to talk about the guidance, I want to address this question, why COVID is so different. There is one big difference between this virus compared to other viruses. For example, SARS virus, although they are both, COVID and SARS are both from the same family, SARS virus can spread only after the patient shows symptoms. And it is usually on day 5 after they show the symptoms. For COVID-19, it is a different story. We know that almost 80% of COVID-19 cases have few or no symptoms. If they don't show any symptoms, it's called asymptomatic. But those people can spread the virus possibly from day 1. In other words, anyone can potentially spread the virus even if they don't show any symptoms. What does it mean for us? It means that when you are at work, you should assume everyone is COVID positive. Because when we know one of our coworkers, our staff or patients is COVID positive confirmed by the test, it is too late for any preventive actions. It is not only too late for you, it is even too late for anyone who is in close contact with you, including your family. What we can do about it? We should take as many precautions as we can to protect ourselves and our society. This guidance supports you to make sure that you are ready. If you feel that you are not ready, don't back to work until you make sure that you are ready. Or if you are only ready for limited services, please do so. Let's remember, it is a gradual return to practice. This guidance must be read in conjunction with college IPAC and Chief Medical Officer advices. It is a very good time for you to review your processes to make sure you are following the college IPAC and this guidance. Keep yourself up to date on COVID-19, but be careful. You should make sure that that information comes from reliable sources. Our college will keep you informed as we learn more about COVID-19. Also, train your staff and those you are supervising. Explain to them the reason behind these precautions. This guidance gives you key measures in order to protect yourself and your patient and your staff from COVID-19. To protect the public, as Judy said, public definition is expanded to all. You need to assess the risk and use your professional judgment in your practice setting. Next slide, please, Leanne. One of these measures is physical distancing. And whenever it isn't possible, you should use alternative, like physical barriers. And if physical barriers are not possible, for example, when you need to interact with your coworkers, then you need to use proper PPE. It means that you need to wear mask or eye protection. Please note that when more than one person work on the same case, there is a possibility of transmitting the virus among those people. You need to put more precaution in place. For example, use mask or gloves. Also, you need to make sure that you know how to put on and remove the PPE correctly. In the document, there is a link for it that you can check. Hand it back to you, Leanne.
So safe practices for preventing transmission of COVID-19 apply across all practices. So as Rose just said, physical distancing. So one of the concerns raised by many RDTs was handling packages and items. So even for shipping and receiving, we have to be mindful of this physical distance of at least 2 meters. And what became popular since COVID-19 is contactless shipping and receiving. So this includes taking payments electronically and leaving packages at the doorstep. So as Rose said, if a physical distance can't be maintained, there are other measures that must be taken, so appropriate PPE, such as surgical procedure mask and gloves. And supplies to perform hand hygiene should also be available. For when running water and soap isn't available, then alcohol-based hand rub needs to be relied on. So in this COVID-19 environment especially, it's important to proceed with caution in every aspect of practice. So all received items you should treat as contaminated, especially for items that have had direct patient contact. So these items should be disinfected or sterilized before proceeding. But also be mindful that it's critical to clean and disinfect the area where decontamination of the case occurred. And so another very important practice is screening. So there's active screening where symptoms are reviewed with patients and visitors. And then there's passive screening, which is the use of signage on doors to alert visitors and request the delay of a visit should a symptom be present. Staff also need to be mindful of their own symptoms and conduct this screening on an ongoing basis. If anyone screens positive, they should contact their primary healthcare provider or Telehealth Ontario for guidance. So the screening questions weren't included in the guidance document because they're subject to change. So they were changed 3 times since they were first published because more was known about COVID-19. So just recently, the ministry changed a number of symptoms that would result in a positive screening. So this is why RDTs are advised to visit the website frequently to ensure that the most up-to-date information is being used. But even with the use of screening, an individual may still later test positive for COVID-19. If this happens, the local public health unit should be contacted for advice on the potential exposure and implications for continuation of work. There's also guidance from the ministry's COVID-19 operational requirements, the document that they just published 2 days ago with the directive, for staff who may have been infected as a result of workplace exposure. So there's information at the bottom of that document. Next slide, please. So in this new normal, RDTs have to weigh the risks of in-person care against the benefits. So additional precautions should be met prior to considering in-person care. So the workplace has to have a space for dedicated patient waiting and care areas. Policies should be established that limit transmission of COVID-19. So for example, defining when patients will be required to perform hand hygiene, entry into the office or workplace, for example, when surgical procedure masks must be worn, and limiting individuals accompanying patients to only those who are required, such as those for young children or those who need accommodation. So where an RDT proceeds with in-person care, they should use contact droplet precautions, which includes gloves, isolation gown, surgical procedure mask, and eye protection. It's also been recommended by all oral health regulators that patients should rinse with 1% hydrogen peroxide for 30 seconds to reduce the salivary load of oral microbes. And after the appointment, there are still things to consider. Clean and disinfect the patient care areas, high touch contact surfaces, and all instruments and devices that have had direct patient contact. So if these above precautions can't be met and all those listed in the guidance and the ministry's advice, the patient should have a right to access care and should be referred to someone who can meet these guidelines. So another RDT. Next slide, please. Back to Rose.
Sorry, I just want to add to that, is that what Leanne has given to you is, if an RDT does not feel that they have an area or they're not ready to have a patient come in for color shading or repair, that they should consider speaking with the dentist. And if the dentist has the ability, has the space fitted for that with all the precautions, then it is possible the RDT could go to the dental office and do it at the dentist's office rather than taking any kind of having a risk outweigh the benefit of having the patient come into their own office. So as the RDT, that's your relationship to manage with the dentist.
And if I can just add something quickly to that, if it's not an addition to your general commercial insurance, the PLI you have with ADTO does not cover you seeing patients at the moment. But again, we can revisit this if that's something that everybody wants added. However, from the past Zoom meetings, has been consensus that for the time being, for safety, the majority of the membership, if not all, wants to kind of stay away from having patients come to the laboratory. But I just wanted to add that on there, just to make sure everyone's safe, right? So thank you for that, guys.
Okay, Leanne or Rose, sorry.
When you create either fine particles or liquid droplets in the air by using high speed, low speed, or other rotary handpieces, ultrasonic, and other similar devices on the dental prosthesis or items that have been in the patient mouth, it is considered as aerosol generating procedure. For example, when you are polishing a patient's denture for repair. Next slide, please. Although at this time, there is no adequate scientific research to assess the risk of aerosol generating procedure in a dental lab setting or even in oral health care, we need to take as many precautions as possible. It means that you need to wear enhanced PPE whenever you are exposed to aerosol that produced from patient dental device. We are not talking about new fabrication here. Enhanced PPE includes fit-tested N95, mask, gown, gloves, and eye protection that can be goggles or face shield. It is important to know why. Although you disinfect the denture or other dental devices that have been in the patient mouth when you receive them, they are porous. It is a possibility that virus can penetrate inside the device, and then when you are using, let's say, a low-speed handpiece to repair the denture, you create fine particles and aerosols which possibly contaminated with the virus. Next slide, please. We've got this question if surgical mask can be used instead of N95 mask for aerosol generating procedures. I would say N95 mask not only filter very fine particles, it fits better on your face. It can protect you better. Besides, when you are generating aerosol, let's say by using rotary devices, it moves the air and causes turbulence in the air. It means that the aerosol can move in any direction. So if there is any gap between the mask and your face, potentially aerosols can go inside. That's why your mask should be fitted on your face when you are doing aerosol generating procedure. Here I have N95 mask and also a surgical mask, if you can see these. I am going to try and show you what is the difference here. If you are just putting the surgical mask and then fix the clip and do, you know, there might be a gap here, like right behind this, and the aerosol can go in. But if you try, this is the N95 mask. If you try this, just be careful when you are trying this, you shouldn't touch these surfaces. There is no gap that aerosol can go inside. So based on the information that we have today, the answer is you must use N95 mask for aerosol generating procedure on dental prostheses or devices that have had patients' contact. However, we don't recommend using N95 mask for other procedures that only need droplet percussion PPE at this point, because we have limited supply and our frontline worker needs them. This is, by the way, this is the old one. It is used before. I'm not going to waste any of them right now at this point.
And that's the thing, as much research as we do, and believe me, there's been quite a bit of research done and looking at best practices and listening to you, you're doing your own research. this is changing. It's changing continuously. So until there is this vaccination, you know, you take precautions. We're giving you the best guidance we can give you. Everything is changing on a continual basis right now. So it's up to each and every one of us to just, you know, stay in tune, do our own research, and then implement. Use your best judgment. If there are any questions, other questions, please feel free to email them to, you know, either the association or the college.
Okay, Frank, thanks, Judy. Franklin and Karim, do you have anything to say?
Yeah, Kareem, you want to go ahead first?
Yeah, I just wanted to say thank you for everybody. And again, this was a lot of information for everybody. And again, a follow-up email will come to all membership. We'll send it out with certain things, because I'm sure a lot of people have missed it. A lot of people have texted me that they weren't able to attend. And so a follow-up email will be sent out to all members that have missed it. So thank you again for joining us.
I want to just say thank you to the ADTO, to Franklin, Veronica, Kareem, the board for actually initiating this, like putting it together. We had a conversation on Monday and it happened very quickly. And that was just so incredible. So thank you, ADTO.
All right, thank you guys. Thank you, CDTO.
Thank you.
And we look forward to your questions and suggestions and concerns.
Right. Stay safe, be well, and have a great day.